I'm Hope Rugo from the University of California, San Francisco's Comprehensive Cancer Center at the San Antonio 2019 meetings. Today we heard really interesting data from a novel oral HER2 tyrosine kinase inhibitor called tucatinib. This was studied in the randomized large HER2 CLIMB trial that treated patients who'd received prior trastuzumab, pertuzumab, and T-DM1 with capecitabine and trastuzumab and either placebo or tucatinib. Tucatinib is given by mouth. It's a greater targeter of HER2 than EGFR, so it's different from many other oral tyrosine kinase inhibitors, specifically different from neratinib and lapatinib. In earlier phase 1 trials, tucatinib had demonstrated activity in patients with brain metastases and HER2-positive metastatic breast cancer when combined with capecitabine, and in preclinical data, the effect of tucatinib appeared to be enhanced when combined with trastuzumab. Hence the triplet combination versus a doublet with a placebo in this trial, as well as the conclusion of patients who had untreated but asymptomatic brain mets and progressing brain mets who could go on to the study as long as they didn't receive radiation right at the time of study entry. What they showed in this trial was first that tucatinib was relatively well tolerated. The grade 3 diarrhea rate was about 13%, an increase about 10% over capecitabine and trastuzumab, the doublet combination. However, the diarrhea seemed to be well controlled and didn't recur over time, so that a dose reduction resolved the diarrhea. So this is actually quite encouraging, and I think the best safety profile we've seen with an oral TKI directed against HER2. However, most striking about the data was a significant improvement in overall survival. So they did show an improvement in progression-free survival, but the absolute difference was only about 2 months. They also showed an improvement in progression-free survival in patients who had brain metastases at baseline in their sort of overall PFS evaluation. They didn't present yet response in brain. But what was, I think, even more dramatic was over a 4-month improvement in overall survival with the addition of tucatinib to patients who were receiving trastuzumab and capecitabine for pre-treated metastatic HER2-positive breast cancer that included patients with brain mets. So you have a reasonably well-tolerated therapy that improves survival. And what they looked at was actually the subset analysis as well. And survival was improved even in patients who had baseline brain metastases. So I think that this sort of overall survival impact of an oral TKI that's well tolerated really will change practice. And in fact, this data will has been submitted to the US FDA, and we hope that the drug will be in clinical practice sometime in 2020 based on these exciting data. The next question is where to use tucatinib next. Of course, combined with T-DM1 makes sense because you might be able to actually prevent the progression of brain mets and improve efficacy. A phase 1 study showed that tucatinib combined with T-DM1 was very well tolerated, in fact, with really little grade 3 diarrhea, much less even than the HER2 CLIMB study. So that trial actually is just starting up now, a phase 3 trial comparing T-DM1 and placebo to T-DM1 and tucatinib. Will be very interesting, and I think the next step after that we'll be thinking about doing this kind of a trial in the post-neoadjuvant setting, and that's planned for our cooperative group, the Alliance, in collaboration with others in the United States, where patients who have not had a PCR to neoadjuvant trastuzumab and pertuzumab, as well as chemotherapy-based neoadjuvant treatment, will then be randomized to receive T-DM1 per the Catherine trial, or T-DM1 with tucatinib as their post-neoadjuvant therapy. So this was an exciting set of data that will change treatment for patients with HER2-positive breast cancer.